Alrighty, well, good afternoon and welcome everybody. Thank you for joining us today. My name is Andrew Duffney. I'm the Instruction and Outreach Librarian at the New Jersey State Library. And it's my pleasure to present our speaker for today, Kim Myers from the Brain Injury Alliance of New Jersey. Welcome back, Kim. Thank you so much for coming back and speaking to our patrons. Today we're going to be focusing on sports safety and kind of talking about the brain injury and how that relates to sports safety and things that we can look out for as our children or children that we know or maybe coaching. How we can better protect them in that field. But Kim is just a community outreach specialist with the Brain Injury Alliance of New Jersey. She holds bachelor's degrees in health science and public health from Stockton University and has gained experience in developing and facilitating community programming on a wide variety of health topics. Through her work, she strives to empower individuals of all ages to lead healthy, fulfilling lives and create a better, more connected community. Before we jump into Kim's presentation, we just have a few housekeeping items to go over. First and foremost, we will be taking your questions at the end of Kim's presentation, but please feel free to send them to us at any time using the Q&A or the chat feature in the Zoom dashboard. Kim has sent me a few handouts that I will be uploading to the chat once we get underway, so you can download them directly from there. If you have trouble accessing them in the chat, don't worry, they will be available as attachments in the follow-up email that I will be sending out. If you have time, we ask you please complete the survey. We always appreciate any and all feedback that you can give us. And if you want more information on sports safety, including concussions, which is a lot of what the discussion will be kind of centered around, you can visit the Brain Injury Alliance of New Jersey's sports concussions page at the web address on the screen there. I will also send that out in the chat so that you have a live link to it. Then one last thing before we jump in, I just want to do a brief overview of the Zoom dashboard. This is what your dashboard should look like if you're using a PC or a Mac. If you're using a mobile device, the dashboard may look a little bit different, but all of the features will still be there. In the bottom left-hand corner, you can check your audio settings. So if you're using an external listening device, like a headset or earbuds, you can check to make sure it's connected properly there. At any point during the presentation, if you run into any issues, there's a raise hand button here in the middle. You can click on that and that'll alert me. I will send you a message in Zoom and hopefully be able to resolve any problems that you're having. And lastly, as I mentioned before, if you have questions, there's the Q&A or the chat buttons. You can use either of them to get in touch with us and we'll be happy to address those. So that is everything that I have for you. So it's my pleasure to turn it over to Kim now.
All right. Thanks so much for the introduction, Andrew. I appreciate it. And thank you for the New Jersey State Library for having me today. I will go ahead and share my screen and then we'll jump into the presentation. So today we'll be talking about sports safety, right? So injury prevention when we're playing sports. We'll talk about ways to be safe and how to protect our brain from getting hurt. It is an important topic, right? Because we know that concussion rates are relatively high, unfortunately. So we want to make sure that we're safe and that our children are safe. So before I go into the presentation, I'd like to ask everyone who here has had a concussion or perhaps knows someone that has. Feel free to put it in the chat if you'd like to share, and otherwise we can move on to the next slide. I'm not seeing anything, so I'll go ahead and move on. Oh, Andrew, yep. Did you want to share or you don't have
Oh,
to?
I've had a few minor concussions from playing ice hockey.
Oh,
So
okay. Yep.
whether getting hit or hitting the ground with, so I'm definitely more prone now, so I have to be careful.
Right. Yeah, absolutely. And we actually do see that hockey is one of the sports with the higher rates of concussion. So that does align with kind of the data that we see as well. Okay, so just to go over some basics of concussion, it is considered a mild TBI. So the terms concussion, mild TBI, and MTBI mean the exact same thing. They're interchangeable. It can occur anytime there is an event that causes the brain to kind of jostle around inside of the skull. And so what happens basically is that we have these bony ridges on the inside of our skull. So when our brain jostles around inside of our head, it hits these bony ridges and it can cause injury. And it can occur from a bump, blow, or jolt to the head, face, or to the neck. And even an indirect blow elsewhere on the body, say to the upper back or to the chest, it can cause this kind of reverberation that transmits a force to the head. And so in order to cause a concussion, it doesn't necessarily need to be directly to the head. It could be somewhere on the upper body or the neck. And so a concussion causes chemical changes that impact the brain function. It's not necessarily a structural injury. And so these chemical changes can be hard to detect diagnostically, which we will talk about in a little while. So this is just a very short video that describes what happens to the brain when someone sustains a concussion.
Each year in the United States, players of sports and recreational activities receive between 2.5 and 4 million concussions. How dangerous are all those concussions? The answer is complicated and lies in how the brain responds when something strikes it. The brain is made of soft, fatty tissue with a consistency something like Jell-O. Inside its protective membranes and the skull's hard casing, this delicate organ is usually well shielded. But a sudden jolt can make the brain shift and bump against the skull's hard interior. And unlike Jell-O, the brain's tissue isn't uniform. It's made of a vast network of 90 billion neurons, which relay signals through their long axons to communicate throughout the brain and control our bodies. This spindly structure makes them very fragile, so that when impacted, neurons will stretch and even tear. That not only disrupts their ability to communicate, but as destroyed axons begin to degenerate, they also release toxins, causing the death of other neurons too. This combination of events causes a concussion. The damage can manifest.
And so that video just shows a brief visual overview of what a concussion might look like, because sometimes it's hard to picture it in our heads if we don't have that exact, picture in front of us to look at. And so there's certain causes that are more common in terms of brain injury and concussion. We see that falls account for about 50% of all TBIs in the United States. It's the leading cause of TBI for especially older Americans. We see that car crashes are a common cause of brain injury and concussion, pedestrian and bike crashes. So New Jersey actually has the third highest rate of pedestrian crashes in the nation of all the states. We see that sports and recreation accidents can cause brain injuries. So falling off of a bike, right? Collision in sports, getting hit in the head by a baseball, say, or falling off the playground equipment. We see that domestic abuse can lead to brain injury, things like being pushed down the stairs, hit in the head, suffocation. And so you see on the next bullet point, suffocation and drowning. So these would be considered anoxic brain injuries. So basically what this means is that the brain is not getting enough oxygen. And so when the brain doesn't get enough oxygen, it leads to brain injury. And so things like anoxia at birth can also cause brain injury. Poisoning is similar. So poisoning is another what we would call acquired brain injury rather than traumatic brain injury. It just comes from a different source, right? So it's not necessarily from an external force, but it's more of an internal event. And that's similar to suffocation and drowning in that the brain is not getting enough oxygen, and so it can cause injury. So going back to concussion, this is just a brief overview of the scope of the problem at hand. So we do see that 15% of all high schoolers sustained at least one concussion in 2019, according to the CDC. We see that 6% of those reported 2 or more concussions. Among children, those who are ages 10 to 14 and 15 to 17 have the highest rates of hospital visits for TBI-related injuries. And research does show that contact sports are the most common reason why people seek care for a concussion or brain injury. So they account for about 45% of visits. We see that contact sports result in 2 times as many hospital visits than non-contact sports and 4 times as many hospital visits than other recreational activities. And some sports that have the highest rate of concussion and specifically emergency department visits due to concussion are football, bicycling, basketball, and soccer. And then other sports like hockey, we said are up there. Combat sports like boxing is also up there on the list. And so evaluating should begin the moment that it happens and where it happens. A concussion can happen right on the field, right? Or it can happen in the classroom or in the hallway. It can really happen wherever. Whoever is present at the time of an event of a possible concussion or brain injury should document things that occur. So making note of how it happened, right? Identifying any signs and symptoms that are present. Is the person alert? Are they dizzy? Do they seem foggy, nauseous, confused? And so monitoring the symptoms to make sure that they're improving or to see if they're worsening, because if they're worsening, it may be signs of something more serious. And it's important not to leave them alone, right? To continue monitoring, checking in with them every 5 to 10 minutes to see how they're doing. And then also eventually, as soon as possible, ideally, a medical evaluation to either diagnose or rule out concussion so that you know what next steps should be taken if there's a diagnosis or not. And so let's talk about the signs and symptoms that you might see if a child has sustained a concussion. So there's some immediate signs to watch out for, and then there's some physical, cognitive, and emotional symptoms that might emerge following the injury, not necessarily right away. Sometimes right away, but not necessarily. It's always important to ask questions to gather more information about the symptoms, as many of the symptoms of concussion do overlap with other symptoms. So if they have other medical conditions, just making sure that that the symptoms they're experiencing are new, they're not necessarily due to any other existing condition. What I would also like to mention, just to reiterate, is that it's possible for symptoms to show up a little bit after the injury has occurred, right? So it might be a few days before certain symptoms arise. Some people have a longer delay. Some people have a delay of a few weeks before symptoms arise, right? So they might not come on right away. And so some immediate signs and symptoms might be confusion, right? So the hallmark signs are confusion, disorientation. Other signs might include loss of balance. They might kind of appear to be clumsy, stumbling around. They might have some changes in mood or behavior. They're acting very strangely, change in personality. They might have a delay in answering questions where it takes them longer to kind of process what you're saying. Again, this disorientation as to what they are, what they're doing, who they are. And so you might see this in some of the movies where a player gets hit in the head, knocked unconscious, and then they come back and they ask them, who are we playing today? Who are we playing against in the game? Where are we? What team are you on? Just like basic information to gauge their disorientation level. And so I do want to reiterate that last point, loss of consciousness, because although a person losing consciousness is a sign of a concussion, not losing consciousness doesn't mean you don't have a concussion. So most concussions do not involve loss of consciousness. There's a big misconception about that. So I just want to be clear that it's very possible to have sustained a concussion, even if the individual did not lose consciousness. And these are some of those that I just spoke about were some of the immediate signs. And here are some symptoms that you might see in the days or weeks following the concussion. It might be issues with thinking and remembering, right? So difficulty thinking clearly, feeling brain foggy, slowed down. Physically, it might be headache, right? Pressure, feeling like pressure is in the head. Nausea or vomiting. We talked about that, loss of coordination or balance. They may be really fatigued, kind of feeling tired all the time, not able to kind of fully wake up. Blurred or double vision can also be a symptom. Sensitivity to light or sensitivity to noise. So just kind of more susceptible to that cognitive overload. Numbness or tingling. And sometimes what we'll hear is that the person just doesn't feel right, right? They'll say, I can't pinpoint anything specific, but I just don't feel right. And so that's also something to keep in mind and look out for. It might be symptoms related to emotions, right? So someone might feel more irritable or sad or more emotional than usual. They might feel that like their anxiety levels are heightened. And then sleep-wise, they might, like I said before, feel drowsy, or they might sleep less than usual. They might be experiencing insomnia, so that can go either way. And then there's also some signs observed by parents or guardians. So again, reiterating some of what was on the previous slide, maybe they are having memory issues, right? They can't remember anything prior to the event or anything since the event. They might lose consciousness briefly, right? They might be confused or dazed or stunned. They might forget things that they wouldn't normally forget, right? So these are things to look out for. And so if you witness someone sustain a brain injury, this is a list of danger signs or red flags, where if you see if a person has one or more of these, it's important to call 911 or get the person to the hospital as soon as possible, because brain injuries do get worse with time if they're not properly handled. So some dangerous signs and symptoms of a concussion for toddlers and infants might be any of these symptoms, or will not stop crying, right? Cannot be consoled. Maybe they won't nurse or eat. And just going over this list, which is really applicable for all ages, is that if someone has one pupil larger than the other, right, this is a red flag. Repeated vomiting or nausea, if they just can't stop, throwing up, right, that's a red flag. If they're having convulsions, if they're having seizures, if they have this inability to wake up, right, so if they lose consciousness or partially lose consciousness and they can't fully wake up, that is a red flag. If there's any slurred speech, right, if numbness, because that could be a sign of a more serious injury. If there's a really severe degree of decreased coordination. If there's a severe degree of confusion, right, if there's very high level of confusion, if they're acting very unusually. And then, of course, if there's a loss of consciousness. So this is a good list to know, where if someone sustains a concussion, that you'll know to call 911 if these symptoms do appear. And so now I'll talk about some myths and facts about concussion. So some facts: most concussions do not involve loss of consciousness, right? So we did talk about this. About less than 10% of concussions actually involve a loss of consciousness. Also, many concussions are misdiagnosed or undiagnosed. So many of these symptoms can be misinterpreted, right, or taken for another condition, or they're unreported. Maybe the player wants to get back into the game and so doesn't report their symptoms. So especially among athletes that are concerned about being benched, right? Maybe they don't see a doctor right away to formally diagnose the concussion, and so it's never formally diagnosed. And then also, concussions do not show up on CAT scan or MRI scans. So like we had talked about before, this is more of a functional injury versus a structural injury. So if someone goes to the hospital with a concussion and receives an MRI or CAT scan, it won't show up on those. And so that doesn't mean that there's no problem, right? It just means that because it's more functional rather than structural, it won't show up. There's no set recovery time, right? So everyone is different. Everyone has different biology. Everyone has a different healing process. And so for some people, it might only take a few days to start feeling better. And then for some people, it might take weeks, or some people have post-concussion syndrome, which can be years long. So it really just depends on the person. There is a cumulative effect of repeated head trauma. So for each concussion, it gets worse and worse every time. They kind of build on one another. And then it's important to note that helmets prevent skull fractures, but not necessarily concussions. And so helmets are extremely important for skull fractures, right? But it's not necessarily going to prevent a concussion. So there would need to be something that would stop the brain from moving inside of the skull, and that's just not possible at this point, right? So think about an egg. If you drop a raw egg from the countertop to the floor, it'll most likely break. But if you wrap the egg in bubble wrap and drop it, the shell can remain intact, but just because the shell's intact doesn't mean the yolk didn't move on the way down, right? So just think of it that way. And so who can diagnose concussion? Only a physician, right, can diagnose concussion. This may be a family physician, it may be an ER doctor, maybe a pediatrician, sports medicine physician. And so it's important, if you witness the incident, to provide the family with details as to how the incident occurred, and any symptoms you noticed, so that the doctor can be provided with this information. It's also really important to ensure that the doctor is brain injury informed, right? They have worked with concussion or brain injury before, because those are all different specializations, right? Not every doctor is going to be informed about it. And so we had touched on this briefly, but since we're all different, the time frame that it takes to start feeling better is different for everyone. So on average, it's about 4 weeks, but this can be longer or shorter depending on the person, depending on how severe the injury was at the time. There's many factors that are involved in that. And it used to be recommended to basically cocoon after a concussion, right? So basically just lay down in a dark room, no stimuli, right? Just lay down in the dark, do nothing. This is now found to be detrimental. So research has shown that this can be really detrimental in the healing process. They now recommend relative rest, which is moderate rest, right? So you may want to take it easy, but not completely shut yourself away. Light physical activity has actually shown to be really beneficial in the healing process. So they do recommend after 24 to 48 hours that someone gets up and starts doing some light walking or some very light kind of cardio, as long as it doesn't exacerbate symptoms, right? So that's the main thing. If it starts to exacerbate the symptoms, it's important to take a step back and maybe hold off on doing that until you feel a little bit better. And then after sustaining a concussion, it's important to involve any activity that to avoid any activity that places the individual at risk of sustaining another concussion. So any, say, contact sports or any high risk activities that might lead to a concussion. It's important to kind of minimize your risk while your brain is in that very vulnerable state. And then after 2 or 3 days, maybe have the child or individual with a concussion test their symptom threshold. So maybe the person reads for 20 minutes and starts to get symptoms. Have them stop the activity. Maybe try again the next day. Maybe the next day they'll be able to read a bit longer without the symptoms coming up again. So keeping in mind that everyone responds to the stimuli differently. So one child might be able to read for 30 minutes while another one might struggle to do so. So the key is a balance, right, between rest and relative light activity, because both of these things are important in the healing process. So there's also a process for returning to sports after a concussion. So it's a stepwise process. These were actually just updated. There was recent guidance posted in 2022. These were updated to be more in line with the current research. So first you want the child to return back to regular activities and then introduce them to light aerobic activities. So eventually the activities will become more complex and include more intensive movement to increase the heart rate. And then when they're ready, they might return to practice, full contact, and eventually the normal sport routine. So as you can see, I won't read them all out, but step 1 is kind of these daily activities as long as they don't worsen the symptoms too much. Step 2 has 2 sub-steps, so kind of that light aerobic activity and then moderate. Step 3, they can get back into individual sport-specific exercise. So it can be sport-specific, but no risk of collision yet, right? So no contact with other players. Step 4 is non-contact training drills. Step 5, full contact practice, and then return to sport at the end. So steps 4 to 6, do you see this line in the middle? Steps 4 to 6 should begin after the resolution of any symptoms, abnormalities in cognitive function, and any other clinical findings related to the concussion. So that's kind of the delineation where you shouldn't start on those last 3 until symptoms are resolved. So why is return to play important? So we see this condition of post-concussion syndrome. This is prolonged recovery, right? Residual symptoms continuing on. An individual may experience this for 1 to 2 months or longer. Some people, like I said, experience it for years. And so these are symptoms that just persist, right? They're just not going away. Also, concussions are cumulative, like we had said, right? So if a child's concussion is not fully healed and they return back to their activity, they're at risk of damaging their brain even more with these repeated blows to the head. And then second impact syndrome may occur, which if it isn't recognized or managed properly, it can unfortunately be fatal. So this is a relatively rare event, right? You might have read it in the news about an NFL player who experienced this, but it is possible, right? We've seen it happen. And so this can cause brain swelling, herniation, and fatality. So basically the brain is in such a vulnerable state, it's trying to rebuild, and then it gets that second impact and it can have really severe consequences. So it's always important to remember that it's okay to ask questions and talk about how you're feeling, right? Share with someone. If you're a child, sharing with an adult. And with some patience and time, you can be back to feeling like yourself again. But it's all the key element here is proper management, right? So having that, seeking that help right away, following through with any treatment plan that's there can lead to successful recovery. And so here's some suggestions for youth. If you think you or someone you know has a concussion, You should tell an adult, right? An adult might choose to bring you to the doctor. The sooner you see a doctor, the sooner you can feel better. So time is of the essence here. Give your brain time to heal. So a concussion, like we said, can take, a couple of weeks to heal, or it could take a couple of months to heal. You may need extra help getting back to normal. You might need some accommodations at school, right? Maybe you can't go back to sports right away. But it's important to keep a trusted adult updated as to how you're feeling along the way. And so it's easy to walk away from this presentation feeling like sports are very dangerous, right? However, sports do have a lot of positive benefits, right? It helps us maintain good health. It helps us learn about teamwork, problem solving. So we don't want to avoid sports, but we want to kind of figure out a way to engage in them safely. So there's ways you can prevent some of these injuries from occurring. Firstly, checking equipment, right? Making sure that first of all, it's the correct equipment for the sport at hand, that any protective equipment like helmets, masks, mouth guards are being utilized, making sure that there's no damage like cracks or rips that can interfere with the efficacy of them. And then also making sure that children are playing on hazard-free surfaces. There's no, changes in, maybe there's bumps or something that they'll trip over. Maybe there's some big cracks. And although I do want to point out, we talked about this before, but although some evidence shows that helmets can help decrease forces to the head, thereby decreasing concussion risk, the extent of this protection is uncertain. So therefore, helmets shouldn't make athletes feel invincible, right? So the most important thing is to wear the proper equipment, make sure it fits properly, and then also follow the rules, right? So that's the next one on this screen. A lot of the rules are in place to keep us safe. So no headbutting, right? No fouling, no using the equipment to hit one another, making sure that everyone's using the proper technique to avoid injury. Thirdly, following the return to play protocol. So that was that 6-step protocol that we discussed before. And it's just kind of a way to ease back into the sport, making sure that our brains have time to heal themselves before jumping back in. And lastly, being proactive, right? So seeking information, asking questions, knowing what the signs and symptoms might look like. Some people suggest obtaining baseline evaluations. So that can help determine if someone sustained a concussion by comparing scores on the evaluation before the concussion versus after the concussion. And so what we always say, bottom line, is when in doubt, sit it out. So if you think you've had a concussion, it's important to let an adult know and to sit out of the game. Because if you keep playing with a concussion, it could hurt your brain more. And you only have one brain, right? So it's important to protect it. So let's see. Now we'll go into a brief pop quiz. Feel free to put your answers in the chat if you'd like, or in the Q&A, whatever works best for you. I have the chat open here. So which is a symptom of concussion? Is it A, sleeping too much, B, not sleeping enough, C, trouble falling asleep, or D, all the above? I see D. Yep. That's correct, Nicole. So it is all of the above. So it can be sleeping too much or not sleeping enough. Maybe someone has trouble falling asleep, but once they're asleep, they're okay, right? So it can take all different forms. Next question, when should someone be evaluated for a concussion? 15 minutes after impact, 30 minutes after impact, as soon as signs and symptoms are visible, or as soon as heavy head impact occurs, regardless of signs and symptoms? D? Yep, so it is D. So it should occur as soon as heavy impact occurs, right? Because symptoms don't always appear right away. It may take a few hours for them to start showing. So it's always important to take these proper precautions. Okay, and true or false? A player can return to the game if they were only knocked unconscious for a moment. Yep, that's correct. So that's false. So a player should not return to the game if they were knocked unconscious at all, right? Or if they were hit in the head at all, right? They should not be returning to the game right away. And what is the average time it takes for the brain to recover from the average concussion? Is it 2 days, 5 days, 10 days, or 2 to 4 weeks? I see A in the chat, 2 days. Any other thoughts? All right, let's see. So it is 2 to 4 weeks. So this is on average. So like I said, for some people it may be shorter, for some people it may be longer. And so I say average very loosely because there's a very, very wide range. All right, and now we'll go on to the more bike and helmet and pedestrian safety side of things. So as drivers, cyclists, and pedestrians, we do have this shared responsibility to look out for one another, right? But brain injury and the importance of being a safe traveler might not be something we think about much until it personally affects us. So here's a few bike safety facts. Each month, 3 out of 4 children in the US ride a bicycle, right? So we do see that it's a very, very common recreational pastime. Every 2 minutes, a child is treated in an emergency department for an unintentional cycle-related injury, right? So this, again, this is a very, very high rate that this is happening every 2 minutes. More children ages 5 to 14 are seen in emergency rooms for injuries related to biking than any other sport. So we see that this is kind of the age range with the highest rates. Helmets can reduce the risk of severe brain injuries by 88%, yet only 45% of children 14 and under usually wear a bike helmet. So we're seeing that less than half of children 14 and under are wearing the helmets, which is definitely a cause for concern. And so an important way to keep your brain safe is to wear a helmet properly. And so this is the, we call it the 2-2-2 rule sometimes, but for this, it's the 2-4-1 rule, right? And so basically you want 2 fingers above your eyebrow so between your eyebrows and the bottom of the helmet, you want 4 fingers around your ears. So forming this V shape around your ear, 1 finger under the strap under your chin to make sure it's tight enough. And then a good way to test it is walking up to the wall and making sure that your helmet hits the wall before your head does, right? And so this is just a general fit guide. So what can parents do? Parents can start habits early, right? Start teaching them early about these healthy habits. We see that the mom on the bike is not wearing a helmet, right? So this is not good modeling, right? It's important to model these healthy behaviors to your children because they do learn a lot from watching parents, right? So wearing a helmet, even if you didn't when you were a kid, even if you don't want to, it's good to model this behavior for your children. And just a quick poll, do bicycles need to follow the same rules as cars? Yes or no? And you can put it in the chat if you'd like. Yep, I see yes in the chat. Yep, so that's correct. So bikes are considered non-motorized vehicles in New Jersey, and the bike rider is considered to be the driver of the vehicle. They should follow all of the rules that drivers do, right? So they should be riding on the right side of the road. They should be stopping at red lights, at stop signs, yielding at yield signs, using appropriate hand signals, respecting traffic signals. And also I want to note that being predictable is really important. So it's important to be predictable to drivers so that they can anticipate your next move, and they won't end up coming too close to you. And then when you're entering a intersection, looking left, right, and then left again is key before entering that street or crossing that intersection. And then looking back and yielding to traffic coming from behind before turning left. So especially when turning left, this is important to remember. So here are some of the bicycle hand signals. So we have the left turn is just the arm outstretched to the left. Right turn is arm stretched out to the right. We have the stop, which is the arm raised to the right with a bent elbow. We have slow down, which is the hand extended downwards to the right. Give way, and then road hazard, potholes, right? That's a more specific one. And road hazard, there's a symbol for too. So these are always good to know if we're riding our bikes on roads. So like we had said before, it's always important to set an example, right? So making sure that we're following the correct pedestrian laws, bike laws, crossing at crosswalks and intersections where drivers expect pedestrians, right? Because if we walk out from 2 parked cars to cross the street, cars won't expect us to just walk out in the middle of the street like that. they'll only expect pedestrians at crosswalks. We do see that most pedestrians are hit at non-intersection locations. And so it's important not to jaywalk, right? You might be putting yourself in danger. You might be putting other people in danger. Even if it's a longer walk to the crosswalk, it's still worth it to just take those, extra 40 yards or whatever it may be to go to the crosswalk and cross. It's just so much safer. And then I do want to note too that even after the symbol says to walk, it's important to look at the cars coming, make sure that they're actually stopping, because we hear stories of these cars running a red light and hitting pedestrians, right? We want to make sure that we're not in that situation, that we're looking out at our surroundings and making sure everyone is stopping before we cross. And so we've talked about distracted biking, right? And I'm sure you've heard the term distracted driving before, but there's also distracted walking. All right, so I'm sure many of us have seen a similar picture to this child on top, where someone might be looking down at their cell phone, texting while they're walking, not looking where they're going. They might run into a sign, or they might, not see a hazard in their path and trip and fall. Or God forbid, they're not looking and a car's coming. So that can be really dangerous and possibly fatal as well. So it's important not to be distracted by these electronic devices that take our eyes or ears off the road. So on the topic of taking our ears off the road, I'm sure many of you have seen individuals walking around with these noise canceling headphones on. Those can be dangerous because we can't hear our surroundings. We can't hear cars that are coming that might be honking. We can't hear bikes that are coming up behind us. So it's important to always make sure we have our senses uninhibited, what's the word I'm looking for? Undistracted, right? So we can hear, we can see everything that's happening around us. Also looking for cars entering or exiting driveways or backing up in parking lots. So when we're walking around the neighborhood, even if we're on the sidewalk, seeing if there's any cars that are backing out of the driveway, that are about to pull into the driveways. Parking lots can be even more dangerous than roads, right? Parking lots can be really chaotic. Everyone pulling out, pulling in, not following the lines in the parking lot. There's so many different things that can happen in a parking lot setting. So looking for cars in all directions, including those turning left or right, is always key. And so now let's look at it in a slightly different perspective. So it's not just you who might be distracted, right? So even if you vow to never look at your phone while walking, you still have to worry about the person texting and driving who's not paying attention to you, or drivers who might have kids in the back seat who are screaming and yelling and distracting them. We have to stay focused and control how we travel because we can't help what goes on in other people's vehicles or what other people are doing. And so it's always key to be a defensive driver, right? To always be on the lookout if anyone else is not following the rules or is distracted. And so we had touched on this before, but bikes should be traveling in the same direction as traffic, right? So they're considered non-motorized vehicles. They should be going in the same direction, and also obeying all of the traffic laws. But when we walk, we want to be facing traffic. So this is what the Motor Vehicle Commission recommends, is that we face traffic when we walk, because that way we can see the cars coming up, they can see us, and everyone's kind of on the same page there. Versus if we were walking on the same side as traffic, we can't see that car coming up behind us, especially if it's a quieter vehicle. And so we might not know to anticipate it. So it's always important to be facing traffic when we walk. Okay. So we'll do a quick quiz here too. True or false? When cars have a green light or green turn arrow, pedestrians also have the walk symbol. I need to put it in the chat if that works. Yep, I'm seeing true. Yep, so that is true. So even though pedestrians have the right of way and it says to walk, if a driver is trying to turn, it's important to make eye contact so they know that you're walking, right? Because they might be in a rush to turn and not necessarily be looking. So again, this is where the defensive driving, defensive walking, right, comes in. And so it's important to make yourself visible and use eye contact. So we've talked about eye contact a couple of times. It's always good practice to make sure that the car sees you before you start to cross the street. And also if we're walking, say on a very cloudy, rainy day or early in the morning before the sun comes out or late at night, that we have reflectors or lights that we have on us so that cars could see us better. Bright colors also help. So if you look at that picture on the bottom right, the father's wearing this black jacket, whereas the girls are wearing these bright pink jackets, and they're much more visible than their father is because of these bright colors. And so here's some final things to remember. So we must be aware of our surroundings when we walk and play. Whether we are playing outside, we're playing in our driveway, at school, at a friend's house, not chasing a ball into the road, right? Always looking left and right before crossing. And just in general, just being aware of our surroundings, making sure that we keep our eyes open, that we're looking around. And so I want to point out this concussion recognition tool I had sent that will be sent out to everyone at the conclusion of the program. It's a small card. It lists all of the signs and symptoms of concussion. So it can be kept in your bag or somewhere easy to access so that you can review it if you think that someone around you may have had a concussion. We also have Concussion Guide for Parents. So this is a great resource for families to look at what the signs and symptoms may be, what the recovery process might look like, what some action steps are, and it just has a lot of great information in that packet. All right, thank you so much for having me. I know I finished a little bit early, so I can take any questions that anyone has. Feel free to put it in the chat, and I'd be happy to answer them.
All right, thanks so much, Kim. If anybody does have questions, please feel free to put them in the chat or the Q&A, and we'd be happy to address them.
Absolutely.
And I'll give it a couple minutes to see if anything comes in. Is there anything out there in terms of mandating training for sports coaches or anything to be versed in concussion protocol and things like that?
Yes, yeah. So there are a couple different trainings. Volunteer coaches have to go through a specific training through Rutgers, or there's another company that has it, in order to get this basic training on concussion and injury prevention. And then there's a different coach training that would be more for coaches by trade versus volunteer coaches. But there are mandates in place that require this training to be taken. And I also want to say briefly, we do have a youth coaches course on our website. So it's free of charge to anyone who is interested to take it. And it's just an asynchronous course that gives information that's helpful for coaches on things like concussion, injury prevention, and different action steps and signs and symptoms to look for. And it's a brief course. I want to say it takes about an hour, but it's just good information to have if you're a coach. Are there any other questions? Feel free to put it in the Q&A or in the chat.
Is the Brain Injury of Alliance working on any legislation or other things to help improve sports safety?
Yes, that's also a good question. So we do have an advocacy division of the company, and they are currently working on this return to learn protocol. So like we shared in this presentation today about the return to play protocol, there's also a return to learn protocol for kids in schools that must be completed before return to play starts. So this would be dependent on the severity of the concussion. This might look like, or concussion or brain injury. This may look like starting to do schoolwork at home before going back in the school environment, maybe going back for half days, kind of easing your way back into the school environment. And this has been a hot topic lately. And right now we are working on, drafting a document that would recommend that all schools have a concussion management team in place, but also this kind of return to learn recommendation. in place. So kind of it's two sides of that. Yes, concussion management teams are a hot topic that we've been addressing legislatively, and then also the return to learn protocol. And I do want to point out too that September is Concussion Awareness Day towards the end of September. So this is perfect timing for this presentation with concussion awareness. And if anyone is interested, the guidelines I had mentioned briefly in the presentation had changed in 2022. So every so often, I think every 4 years, there's an international conference that concussion professionals, experts, researchers go to kind of review all of the most recent research that's been posted, that's been published, and then updating the concussion recommended guidance based on that. So I can send that document out afterwards if you're interested, but there's been these updates.
Alrighty, I don't see any other questions. Anything you'd like to close with?
Sure. Yeah, just briefly. I think that the bottom line, right, is just making sure that you're educated about how to protect yourself, right, whether it be with sports or with recreation, like bicycling or even just walking around town, being aware of these prevention strategies and just being aware of our surroundings and knowing what steps to take if something does happen. All right. So it's all about preparation. And thank you again for having me. I really appreciate it. And thanks to everyone for joining. I appreciate you taking the time to join today. And I hope it was educational for everyone.
Well, thank you so much, Kim. And again, thank you everybody for attending today. This program was recorded, so a link will be sent out once it is available to everybody who registered, as well as copies of the handouts. So again, I'd just like to thank our attendees and Kim. Be safe, be well, and hopefully we'll see you soon.
Thanks so much.